name. Yes.
Yeah.
Yes. And you have to celebrate it. You can't just bypass
Uh-huh.
Juji's name day. It's important. Okay. We are awesome. We are on, and welcome everyone. Good afternoon, good evening, good morning, depending on where you're coming from. Want to announce that we have Hungarian translation under the Japanese flag, and we have Spanish translation under Spanish. Really want to thank Peter in Hungary and Karas, who's helping us. Really appreciate you. Sziasztok. And also, hola to our Spanish-speaking friends. Oscar LeBaron, who's a diamond in the business with his beautiful wife, is going to be translating. So really appreciate both of their time. And my name is Diana Rader-Zisselman. I've been in the business 12 years, 13 years, time flies. My background is in healthcare. I was an executive at a national healthcare company. Prior to that, I had been with my Pfizer Pharmaceutical, and I was a big skeptic. I had no interest in network marketing, but I was super impressed by the science. My husband is a business guy, and that's what drew him in. We're friends with the Tillotson family and have been for years. So they, as founders of Nu Skin, they used to send us products for free. Now we pay for them. But I really needed to go and actually see the labs and see the science. And I'm so excited to get to be spending time today with Dr. Joe Chang, who was one of the reasons that I was drawn to Nu Skin. And I was telling him a minute ago, I want to just condense his bio so that we don't spend a lot of time on it. And I can't, because it's so impressive. Just to give you all some idea of who Dr. Joe Chang is. He's the Executive Vice President of Nu Skin Enterprises. He's the Chief Scientific Officer for Nu Skin and Pharmanex products. And prior to Nu Skin, he directed more than 60 scientists in drug discovery research, including research into dermatological products. And he also was in the pharmaceutical industry. He served as president and CEO of 2 privately held biotech companies. He has a doctorate in pharmacology from University of London. He was a fellow at Johns Hopkins University in pharmacology and experimental therapeutics. I'm sorry, he's a member of the New York Academy of Scientists and American Society of Pharmacology and Experimental Therapeutics. He's a prolific writer. He's written many articles, many reviews, many books on scientific research during his 18 years in the healthcare industry, probably 19 or 20 by now. Co-authored a textbook on inflammation and developed a series of monographs on botanical products to serve as a source of information for consumers and health professionals. I think one of the most impressive things prior to all that he's done with Nu Skin Pharmanex is he was responsible for the discovery of a novel anti-rejection drug called Rapamune that is derived from natural sources, and it's currently the second most prescribed drug to prevent organ rejection. So Dr. Chang's not your ordinary PhD. He is exceptional in the world of science, and I know a lot of you are really excited about the product we're going to discuss. We've been talking about it for a long time. I know, Joe, you've been thinking about it for a long time, and it's been formulating, and I've never been with Nu Skin when there was more excitement about a product launch. And so if you would give us, just so you know, this call is for North America, South America, Europe. There's a lot of people on. And so we're going to be able to kind of differentiate, because different markets, we can make different claims about this product. So Joe, I would love for you to come on and spend some time giving us a little bit about the history of why you wanted to develop this product, what the importance of it is, some of the benefits, and we can go into all the things. So if you would go, less from me, more from you. And you're muted, so I'm sure you were saying something critical.
Yep. I'm sorry. No. I was just saying we'll treat this as a conversation and a chat, right?
Perfect.
So as we go through, we just don't want to do a formal presentation from my side. And sort of a discussion format might be actually a bit more productive for many of the folks here. And we're already starting to get questions, which I sort of assume when these questions are coming through that the Wellspa is available in Europe. And I noticed some of them are also Asian. So looking at the names, it seems like there's some folks from Korea as well, and so on. But anyway, I'm just going to assume that that people have heard a little bit about this device, but I will sort of give you a little bit of perspective of how we came about developing this particular product. It is interesting with your introduction when it reminds me, more than 20 years ago. That's when I was one of the co-founders of Pharmanex, and more than 20 years ago in 1998, that was when Pharmanex came together with Nu Skin, you know, and sort of joined and it sort of merged together as one company. And it's always struck me as sort of an interesting because when I looked at Nu Skin, why and the reason why they actually were so interested in acquiring Pharmanex was because of this possibility, the future potential, how we can actually integrate, the skin health together with wellness, the internal health, I will call it, right? And at that time when they were looking at it, it was really more of a vision, and it was more or less something sort of a glint in our eyes, and we're never quite sure how we can actually execute on that concept. So and on the scientific side, and then I was looking at it and I'm saying, gee, yeah, we're the only company, frankly, where we have a lot of extensive knowledge of skincare. We have a whole bunch of products we've developed looking at bringing benefits to the skin. And then now with the acquisition of Pharmanex 20 years ago, we have also created and developed a whole bunch of products for better nutrition inside the body. And I would challenge everybody on this call to sort of really look extensively, at our competitors and so on. I doubt you can find another company that has that equally robust skincare line that is so intimately connected to a nutritional supplement category or product line, right? Usually, typically, you're strong in one, but not in the others, and vice versa. And Nu Skin has achieved a status right now where we really have two. I mean, if you just look at our revenue as a metric, you can see 50% of our revenue comes from the Pharmanex nutrition products, and then the other remaining 50% comes from the Nu Skin kind of skincare products. So it's very nicely balanced. So and our vision now going forward is that we have indeed become a truly integrated beauty and wellness company. That really, for all intents and purposes, is really what we have become and evolved into. Now, so this idea, when I was looking at the skin, right, as soon as I joined Nu Skin 20 years ago, I said, well, one day we'll be able to do it because after all, the skin is part and parcel of the body, right? I think we all appreciate the fact that the skin, when we look at it, is on the outside, but really, when you sort of look at the science and how it is part of the body, it is in fact the largest organ of the body, except it just spread throughout the whole body, right? You don't really see that. But you aggregate it together, it is the largest organ in our body. So when you manipulate that, the concept therefore becomes, I say, well, we're doing a lot of stuff on the skin. And somehow, if we're bringing benefits to the skin, surely by manipulating the skin, we can also manipulate what's underneath the skin. Okay? Because the skin is connected to the muscle and connected to a system, which I will talk about very soon, very close to each other. They're intimately connected. So when you're manipulating the skin on the outside, surely some of that manipulation or stimulation, if you will also be sort of translated or communicated to the rest of the internal tissues. That was it was sort of I think it was a simple idea at that time, but I'm not sure 20 years ago we could have executed and developed a product to be able to do that. Because we didn't have enough of the science yet, we didn't have enough of the engineering yet, and we didn't have enough of the technology. Okay, so these were the three elements that we have to bring together to be able to achieve this this objective, and that is to both bring beauty and wellness benefits together into one product. So
Well,
that's
it's funny
the
you
genesis
talk about it.
Yeah.
When you talk about it, I just think, I've done enough scans, and that some people may not know about the biophotonic scanner, but it measures your antioxidant levels and kind of gives you a good picture of overall health. And someone can walk in a room and I know if they're going to have a low scan score. I can just look at their skin and this is not a healthy person. And then someone else will walk in and they're glowing and I'm like, oh yeah, that's a healthy person.
Yeah. So, and then there you go. It's very visual and it's very sort of indicative of the overall wellness or well-being that you have inside your body by just a reflection of the skin. So, let me bring up some slides and share with you. I think that might trigger some of the message points that I think that could be very useful to you. So share screen, share this. Can you see it?
Yeah, we see. Yeah, now we're seeing all the slides.
Okay, I'm going to bring up one slide at a time, put it on a projection mode. Okay,
perfect.
So anyway, so this is the device that we're going to talk about that's shown on this particular slide. It's called the Wellspa. Many of you, if not all of you, have seen it, but I'm going to give you some background behind it and why we're so excited initially about the science and the benefits that it can confer by using this particular device. And I think you're going to find it when you use it, that those benefits are truly meaningful. But we are now the number one. For intents and purposes, right? There was another notion when we look at it. Over the years, we have developed the galvanic, the LumiSpa, the Boost, and so on. We have several devices, including actually the biophotonic scanner. But when I look at all these devices, it's either very much focused on the face, on the skincare side, or is a measurement tool like we have in the biophotonic scanner. They're all very useful, and indeed, when you look at what we have become the number one world beauty device systems company. And it has brought more importantly to me is that with the development of these devices, it gave us a lot of data and insights in terms of what we should be doing next. And that's one thing, when you combine all that data together, that's also contributed to the development of the Wellspa. On the science side, this is where it sort of really dawned on us, right? And I already hinted at this, and that is when you manipulate the skin, you're also manipulating a network of vessels that are very closely connected to the skin. All right. And this network is called the lymphatic system. Okay. Now, why is it so important, the lymphatic system? Well, when you look at the lymphatic system, in terms of its distribution around the body, it's actually 3 times wider, and there are more lymphatic vessels than blood vessels, for example. All right. The pink, as shown on this particular slide, is the blood circulatory system. The green is the lymphatic system, and it's much wider than the blood system. Now, there's another very significant difference between the two. We know that the blood can only circulate throughout the body with the help of what we call a pump. and the pump is the heart. We all appreciate very quickly that if that pump, the so-called heart, stops, the blood stops circulating, right? And for intents and purposes, within a few minutes or within some minutes and so on, the whole body shuts down. So it's very, very important for that heart to continue to pump the blood throughout the body, which means what that translates to is the fact that regardless of whether you're sitting down or standing up or lying down, it really doesn't matter the position of the body. The blood will circulate actively throughout the body. So that's how the blood circulation works. By contrast, on the other end, when you look at this schematic, you notice that the lymphatic system lacks a pump. It cannot pump on its own. Okay, so it requires some other means to actually help the lymphatic fluid to move throughout the body. And why is that important? Because it's actually underappreciated the fact that the lymphatic system, for all intents and purposes, is actually your sewage system in the body. It is critical for that lymphatic fluid to move to eliminate any toxic metabolites that are being produced during the functioning of your body. Because invariably, the body is really not very different from a car engine, for example, as an example. You breathe in the oxygen, and the oxygen or the food that you take and so on, and all of that is being converted to energy to drive the body or to help the body to function. Now, that particular metabolism, in aggregate, we call it body metabolism. That metabolism is not 100% efficient. As it functions and as it proceeds, it will generate some natural toxic metabolites. And those metabolites have got to be excreted from the body constantly. That's why you have the kidneys, right? We all appreciate the fact that if our kidneys are not working very well, those patients will have to go for dialysis. If you stop and ask yourself the question, what's the purpose of the dialysis? It's really to remove all these toxic metabolites I've been talking about from the blood, and you run it through and you take it out because the kidneys are not functioning. But that's the end stage. That's the end of the whole elimination process, if you will. The beginning of that process starts with the lymphatic system. It collects these toxic metabolites. It is an intimate communication with the blood, and eventually it will then be excreted by the kidneys. So we were thinking that if you have something that can help the lymphatic system to move well, you will have an opportunity and a possibility to purify the body, to help the body to really go through and enhance its purification system.
Well, one of the things that I learned from you recently, Joe, was that the only way to do this, other than, I used to get lymphatic massage every week when I lived in Utah. Once Jeff was diagnosed with cancer, we got lymphatic massage. But what I learned from you, and it makes sense now, because I was like, humans have been around for millennia. What did we do before? And what I learned from you was that muscle contraction helps with that. Right. And so, but that's the only natural way to do it is through muscle contraction. And we obviously just don't move our muscles like we used to when we were nomadic and walked everywhere and we're constantly hunting. And so it makes sense that now our bodies just aren't equipped to be as stationary as we are. Right.
Yeah. So I mean, a good illustration of that phenomenon is when you get onto a plane for a 6-hour flight. And eventually, I mean, if you take your shoes off and then before you land, you put your shoes back on, you're going to find it a bit more difficult to shove your feet back into those shoes, right? Because your feet have swollen. Okay. And that is the direct result of the lymphatic fluid, coming out from the vessels and pulling around your feet and your ankle. So that's what happened because you're not moving your muscles, as you indicated, Diana. And because of the lack of muscle contraction, especially in the lower limbs, your fluid cannot go up to your chest. As shown in this particular slide here, this diagram of a person, the major reservoirs of this fluid, they all have to come back to around the chest area. There are two very important lymph nodes, we call them, on both sides of the chest. And those lymph nodes act like reservoirs to collect the fluid, process them before they get dissipated out again, or on the other side to eventually land in the kidneys. Okay, so that's really when you're standing up or sitting down, you can imagine gravity is going to pull the fluid down, and if you don't exercise your muscles and so on, it will not be able to. The fluid will not be able to move, and therefore you have some edema forming. All right. So that's a little bit. So this is really a confirmation of what we just talked about. As you move your calf muscles and so on, that's when it contracts that lymphatic line, as you see here, this lymphatic vessel, and therefore as it squeezes it, the muscle, it will start moving the fluid upwards towards the chest area, right? And that's why it's so important to be able to. That's the only way that the lymphatic fluid can move, right? Especially when you're standing up, and sitting down in front of a computer and not moving. You know that most of us, I have that kind of sedentary jobs or work that we do that will also contribute to some edema formation. You know,
definitely, even as, I mean, Jeff and I are active people, but we still were getting weekly lymphatic massage just to move that fluid because it still doesn't always move efficiently. So
not efficient enough, no doubt. So, all right. So that's really what it is all about. So how do we help the lymphatic fluid to move better, regardless of what we do? All right. And how we work and how we function. And that's where we came up with this idea of the Wellspa. And this idea is really interesting. I've magnified these so-called metallic nodes here. There are 4 of them at the bottom of this device, okay? And you notice the design, and this is where the engineering, our engineers came into play here. And that is the shape of this particular metallic node is critical to have this device to be in constant contact with the skin. All right. And I'll tell you in a minute why that is so important. Because when we look at our skin, especially this is a body kind of a device and not just for the face, depending on the location of where you're using the device, these metallic nodes, we call them, will help because the skin is actually undulating. It's not absolutely level, okay, and smooth. So as you move the device, you know, you're going to compress the muscle and so on and the skin. And if you have a flat surface, it's not going to be as efficient to keep in contact. All right. So I'll go into that a little bit, why that constant contact is so important. But fundamentally, this particular device will give you 3 overall, depending on the markets and so on. But nonetheless, if you aggregate the benefits, both the beauty and wellness type of benefits that can be delivered by this device, it comes out, and I can summarize them under these 3 categories. It will restore the body to a better well-being or wellness state by using it. All right. It will also help to revitalize the skin. And this is where, during the translation, it's important to realize, and because I think there's an unintended consequence here. The word in English, revitalize, some people may be associating it with the rest of the body as well, but we are really trying to group those skin benefits together under one umbrella, and that is under the revitalized umbrella. Okay, you're going to look better, your body is going to shape better, and so on and so forth. So all those skin benefits, cellulite and whatever that you can see on the skin will actually be grouped and categorized under this umbrella called the revitalized benefit, right? And then there's another one, it's called refresh in certain markets, it's called recover in certain markets. We just want to make sure that you understand that this particular benefits is very much associated with activity. And that is to help your body to during a pre-workout or post-workout, that you need to use this device, because I think it will help you to have a better and more effective workout if you use it before the workout. But if you use it after the workout, it will help you to recover quicker. You cool down, you use the device, and it will help you to have a way more, the outcome of the workout would be better enhanced and accelerated in the presence of this particular device. So
and just, I want to interject real quickly out of respect for our friends at the FDA that this is primarily for markets outside of the US, the language we're using, and the name in the US will not be Wellspa, and we're not yet approved. So if you are in the US, please do not share pictures, do not put anything on social media. We really want to respect the process of getting this approved so that we have it, since we haven't had a body type spa in forever in the US. So just know that this is a global, like we're talking to many different markets. The US, please, please, please don't share this yet. Do not call it a well spa, and don't make any.
Great reminder, Diana, on this one, on this particular point. Yeah, because it is undergoing FDA review right now, and hopefully, we'll hear from the FDA very soon. Okay.
Thank you.
All right. Great reminder. Okay, so this is, and again, this reminds me that we used to have, and perhaps some of you may remember and recall, a device that we called the body spa several years ago. I think there's a huge difference, right? In fact, I would imagine this is not just an upgrade of that body spa. This is an entirely different type of device that we have developed here. And it's because of these three important things. The design, I've already mentioned to you, those metallic nodes, that's a unique design, and it brings, it's just, we actually learned from the previous body spa, and that is a flat surface. No matter how you make it to look like a sneaker sole or something, it really doesn't matter. It's still flat. It's difficult to achieve the constant contact we need for the microcurrent technology. And the second point is that this microcurrent technology that we have developed, we also learned that we can actually adjust it because of all the sensors, progress and advances we have in those areas, that we can actually have it adjust in such a manner that it will bring a new level of comfort to this particular device as the microcurrent travels across the skin and to achieve its benefits, right? And then finally, last but not least, the third feature is I'll talk about those topical gels that we are launching together with this particular device. Those gels are truly unique and proprietary to us, and it will enhance and maximize the benefits because there are active ingredients in those gels that you can't find anywhere else. So here's the design on the engineering piece. I already mentioned about those metallic nodes at the bottom here, but importantly too, this big handle, or whatever you like to call it, we felt that the previous one, without this particular handle, the way that it's designed, the challenge would be that once you use the gels together with the device, that it's going to become slippery and you might drop it. So it really, when you hold it on this particular handle here, you'll find there's a comfortable feel, and you don't have a sense that that device will slip out from your hands and so on. So we feel that this particular grip design has been optimized, for you to use it because especially the gels, we sort of the reality is when you use gels, some of it will get onto your hands and so on anyway, and it becomes a bit of a challenge to hold on if you don't have something that looks like that. So the microcurrents is interesting, and this is where we're calling this the continuous comfort control, because it adjusts constantly. In fact, it adjusts more than 80 times a second and so on. And what we find, there is a particular microcurrent range we have to be within to achieve the benefit, to stimulate the skin. All right, it cannot get out of it. And this is where the constant contact with the skin or connection to the skin is important, because once, without you sort of recognizing it or feeling it, if you lift it a little bit, the device will automatically adjust to increase the current, because when you lift it, invariably the current will drop, right? So we have a sense that say, hey, for that particular second or whatever, if it's not in contact with the skin, let's increase the current a little bit so that it can be maintained within the effective range. That's what happens, right? But we don't want to increase it too much, because then you sort of, some people with more sensitive skin will sort of feel a little tingling sensation and so on. And we don't want that to happen. So it will constantly adjust. This microcurrent technology is very different from what we had done before with the galvanic current and so on. And it's important for stimulating the skin. And now, in order for you, before I do that, in order for you to conduct this microcurrent, that's where the gel comes in, right? The current will not travel and stimulate the skin on dry skin. It has to have some gel to help it to complete the circuit, if you will. And therefore the gel is pretty critical. And that's why sometimes I think when you use it, you might feel a little bit of tingling sensation when the gel dries, and that's because of that difference in current on dry skin versus wet skin. So,
and is there any harm in that, Joe?
Not really. It's just a signal that you have to use more gel to achieve those benefits. There's no harm. It's really just a tingling sensation. It's just like, some people with sensitive skin will start to feel it, but immediately that device will adjust itself to eliminate that tingling.
And I'm sort of a more is more person, so I like to use it really hard. Is that a problem?
You need to really bruise yourself with the device, Diana. Yeah, you should use it in constant contact, but really, I don't think you need to.
It doesn't make a difference if I go really deep, or I mean, I'm really pushing. It's okay, or not.
But it's unique. Once again, this is a patented microcurrent. So I realize sometimes, I can talk about this and I will not be able to sort of accompany you to demonstrate this device, for example, to a new person. So we have included, and this is where the I/O connection comes in. There is a pairing you can do with the device together with your smartphone. And when you have paired it, you can actually demo what's actually happening. This particular slide shows you, if I click on that, I think it, just shows you how you can use this particular device, because the lymphatic system, if you recall, I told you have to move it upwards, right? So you notice this arm is hanging down. So he's moving it upwards to make sure that the lymphatic fluid is returned to those lymph nodes around the chest. But if he has those arms horizontally, if you will, he will be moving it towards the chest. As always, he may even use a 360, a revolving action to do that. All right.
So it doesn't, when you do the 360, it doesn't necessarily push the fluid back down.
No.
Okay, good to know.
No. Yeah, because that's why I indicated to you on this particular demo, the arm is hanging down, right? That's why you have to move it upwards.
And you do go back and forth, even though, because when I do it, I go harder going one way than the other.
So Anyway, so just to repeat myself a little bit, these are the four metallic nodes I've shown here. And as you use it and when they're in contact with the skin and you move it over the skin, you will see the lymphatic system being sort of, accelerated and stimulated. Okay. That's the second one. So you are unique somewhere, and this is just to remind me, telling me that each and every one of you, depending on where you are, how you live, and so on and so forth, you have certain features or factors that impact your skin health and overall, and how we have to take into account these 6 particular factors to make sure that you have good contact with the device. The device has good contact with the skin. All right. So, and again, that's where the IO come in. I mentioned these sensors that we have built in. You can't see those sensors because they're inside the device, and those sensors will help us take into account the variation or differences in these 6 factors, as I've shown here. All right. Okay, the third piece is the gel, and this would be the patented gel, the H-lock technology that we have used. And again, I won't go into H-lock because many of you would have sort of appreciated the type of gene expression and genetic science we have been doing and incorporating those insights into our products. So we have developed and included many of these active substances into the gels. All right. And the activating gel, for example, has several ingredients in there that will deliver what we call, body shaping benefits and so on. And it's also include one particular substance or one particular ingredient that when it goes, because when you use the device, right, what happens is the skin becomes really quite responsive, and that responsiveness of the skin will help to deliver the active ingredients into the skin, right? And that is what happens when those active ingredients go inside the skin. It will help to stimulate the skin and release certain substances. One of them is called endorphins, and it will help to give you a sense of well-being when that particular endorphin is being released. Now, there's a smaller thing over in the middle called the body serum. This is also a gel, and you can use this sort of, in place of the activating gel when you have it. And this one, you can also accomplish some body contouring, cellulite, and all these other benefits together with the body serum. It has more active ingredients, and it also has more wellness benefits associated with the body serum. All right. So both of these gels, when we develop them, frankly, I mean, we developed the body serum to be a standalone product at the very beginning. But when we tested it together with the device, it actually works really well. And they synergize together, the device together with the body serum. And they can be used, and you don't need to wipe it off. Unlike many of our gels previously with the other devices, they had to be wiped off and so on. But these one you can leave on because the viscosity and so on and so forth, it's not as thick as the previous ones. So
and if someone wants to, for example, I have a lot of conductive gel that I've collected over the years. Is that effective with the spa? Just the old conductive gel?
You can use it to conduct the microcurrent, but those particular gels don't have the similar or the same active ingredients that we have developed in the activating gel here or in the body serum.
So you won't get the same results.
Yeah, won't get the same degree and the same level of benefits or the spectrum of benefits you can get, especially with the body serum.
Got it. And why is it important to use the exfoliator, which is on the far right?
Okay. This pink a tube, which Diana calls the body polish, that is supposed to be used on its own. All right. You don't need it because one of the things is when you exfoliate the skin is going to be, once again, when you don't have that level of dates, a layer of date skins, because that's what exfoliation is, right? Is the removal of date skin cells, because skin cells do die every 28 days and they accumulate and stay on the epidermis, the topmost layer of the skin. When you remove it, the skin becomes way more responsive to the device, and also the active ingredients in the gel will work much better, right? And on the practical side is also that visually you can see your skin to be a bit more healthier looking in the absence of that date skin layer.
Awesome. Thank you.
Okay, some before and after. I've talked out enough of the science, and really fundamentally what happens is that these are arms, right? And this is what happens to the bottom of the arm after the use of the Wellspa. Right. I think you can see pretty good. And this is over a period of I think roughly week 12 or something. Yeah. You can see a distinct and significant improvement in the tone of the arms. Now, the bottom bit refers to the back of your thighs. You also notice that left baseline on both of these individuals. In fact, the right one has more cellulite than the left one. But in either case, you can see after using the Wellspa, the cellulite looks far less visual and less evident. You know, the skin looks smoother, and it's sort of really, the cellulite is less evident. This is sort of
things, go ahead. I'm sorry.
Go ahead, Diana.
No, I just was going to say that one of the things that's really impressive to me is that the thigh on the lower right, I mean that before and after, it's so dramatic.
Yeah.
And I know historically, because Nu Skin is so conservative about making claims, even if they're legitimate, that we won't publish pictures that are sometimes too good. So I know I'm like, this has, I mean, we make sure that nothing's doctored, nothing is done except this device. And I am blown away by that result. And that Nu Skin Legal said, yeah, you can share this because we've got the proof. Yeah. I mean, that's a remarkable picture.
I'm going to show you some more before and after pictures. And these are really not done under clinical conditions and so on, but is really in the real world, if you will. It's sort of interesting. So here are varicose veins, right, on the left. And after the use of the Wellspa, you notice the varicose veins are less evident too. So not just cellulite, but the appearance of varicose veins, when you use this particular device, it seems to be, you can actually make those varicose veins less visible. Okay. Now the middle panel is another interesting one, because this is really the tummy area or the stomach area. And this is again before and after the use of the device. You can see it toning the muscle enough to be able to see some muscular definition of the stomach area after the use of the device. Okay.
Sorry, I'm still stuck on the varicose veins. Why would that happen? Like, what's the scientific?
The varicose vein is microcirculation in a way, right? So fundamentally, the veins, the reason why they look purple like that and so on is because veins, once again, is something to do with the pooling, in this instance, of blood. Okay, so what happens is, I'm perhaps speculating a little bit, but I think I'm probably right, is the fact that as you move with the device, you're moving the venous blood back into the chest area. You're helping to move, because the veins are, unlike the arteries, the blood flow is not so good. So you're helping the blood flow too, in addition to the lymphatic system.
Wow.
Okay, and that's why it looks less visible. The varicose veins don't look as visible now because the blood is not pooling in those veins.
Perfect. Thank you.
So there's a stomach area. This is sort of interesting, right? There's some, we talk about ankles and so on. Here's some of the proof with this individual where I think you would agree with me that this foot is more swollen than the right one. Same foot, and this is before and after the device. And you can see the swelling is helped by the use of the device on this foot.
Wow.
Okay.
Amazing.
So you can see. So really, I mean, to bring it all back together, I think that the connectivity of the device is going to be very valuable to all of you. And because it will coach you how to use the device. There's intelligent coaching features built into the app. And this is the very app that that will contain the Wellspa feature. And then it will also track how you're using it. This is going to be useful as well because it will tell you, or it would actually tell us too. I mean, are you using it in the morning, the evening, or whenever you use it? So we'll be able to use that data for future improvements or upgrades or whatever we need to do. Okay. And there's some business sort of features added to this particular Vera app too, so that it will help your business opportunity to go way more smoothly. But nonetheless, lots of interesting. The microcurrent too, while you might not feel it when you use it, we are going to put a feature onto the smartphone that in real time, you'll be able to see how that microcurrent is behaving as you move the device at different parts of your body and so on. All right. And it will show you exactly what's happening. So that's really, in a nutshell, hopefully it'll give you some knowledge about the device and how we developed it and why we think it's really one of the most exciting and unique devices we've ever developed. And it's all about balance, really, when I think about it, at the highest level. What does this device deliver? And I think what it delivers is really, the lymphatic system, a sort of a purification benefit. It helps to move the blood. I think the microcirculation too. And overall, it really sort of balances the body, because wellness is all about returning your body to some optimal balance. And I think this device helps to do that quite a bit. Yeah. So, and delivers the skin benefits and now the wellness benefits, all totally integrated into one device. And I don't think you will see this device anywhere else. It's clearly unique as a product.
And how many patents do we have on this one or pending?
I think pending about 3 or 4 now. We've published some of the papers and so on. So it's clearly the engineering design is unique. There's a patent pending or application undergoing that, the microcurrent and so on and so forth. So.
And I have lots of questions that people have submitted. So
right.
couple easy ones. Will the body shaping gel be replaced by the activating gels? And can that be used with the spa, the body shaping gel?
Yes, you can use the body shaping gel, and here's some practical, less scientific, but more or less maybe useful to you. The body shaping gel, when you use it together with device, actually produces a change in the color of the gel. Okay, so for a demo, and if you're demoing this particular device to a new person and so on, I think while you're explaining a science, or maybe you don't wish to really go into that much of a scientific explanation and so on, that demo in and of itself is very good because it changes color and it shows that the device is working, really well on the skin.
And when you say that, you mean it changes color because it's really purifying
yes.
the top
Yeah,
skin.
because remember, right? I told you that the skin renews itself almost like every 28 days, and the existing skin layer or the skin cells, they die off. So what you're doing with the shaping gel is, in fact, you are actually, in a way, scraping off those skin cells. Okay, exfoliating. I think maybe that's a more technical way to say it. And when you, as in during that process, when you do it, and all those dead skin cells accumulate together, it will change the color of the gel.
Awesome. So you've got proof. I love that. I love that you're thinking about our demos. Thanks, Joe.
Right. So you can do that before. It's almost like a half-face demo kind of equivalent, right? Yeah.
Awesome. So, okay, another question. In Canada, what's the difference in benefits with the activating gel and the cellulite serum?
None. I think you might be asking that, you might be prompted to ask a question because it might be a different name in Canada. I can't recall, but yeah, the Canadian gels are the same. Yeah.
Perfect. And big one, can we use it every day?
For this one, yeah, I think so.
Let's see. Okay. As far as the lymphatic drainage, swelling, etc., what's oh, this is a long question. What's the best for that? Which gel is the best for that?
I think either gel will be fine. Okay, to be honest, on frank on this one. To truly move the lymphatics in is how you're going to use the device. That's probably more important. Okay, I already mentioned the fact that if you're using it on your lower limbs, I would imagine that you need to move it upwards, right? So that is an important thing to help the lymphatic system to work well in those lower limbs. I already talked about the arms and around the stomach area. You can move it around without moving it upwards. That's also fine. But anytime when you go below the waist, I think it's make sure that you move it upwards.
Okay.
Okay.
Let's go to the chat. Okay, so this person has a customer, Jane has a customer with had melanoma tumor removed and from the thigh and many lymph nodes and is now cancer-free, but has lymphedema. Is this okay to use?
Yes, yes. I'm hoping it will help them. Yeah.
Awesome. Thank you. Is there a restriction? This is a good question for people with epilepsy, like there is with other kind of devices.
I would imagine it will be the same precautions that you take with the facial spa would apply with the body spa. Yeah.
And as always, ask your doctor.
Yeah, ask your doctor to see, make sure that it's okay, especially with a condition like epilepsy, I would imagine. Yeah.
What about, okay, pacemakers or titanium plates to support
Yeah,
spinal structures?
yeah.
Also ask your doctor. So, and this was a question I had gotten previously. Someone had heard you can't use it on the spine or the neck area. Is there any reason you would?
No, for me, no, especially on the shoulders. That set of muscles there, that would be perfect to use the Wellspa on to get a sense of well-being.
Perfect. Okay. Someone say Orshi in Hungary says she experiences a little discomfort during the massage. I don't know if she means stinging, like there's not enough gel, or that's probably the discomfort.
It depends. She has to be a little bit more specific in terms of what she means by discomfort. Yeah, if it's tingling, definitely it's the lack of gel. I noticed Susan, my dear friend, has already mentioned it happens with the facial spa too, right? When the gel dries out. So
yeah,
will happen with this too.
Someone asked the difference between the activating gel and the activating serum. I have one of each here.
The body serum. Are you talking about the body serum?
Well, one is the body activating gel and the other is Dermatic Effects serum.
And the question is,
What's the difference?
oh, thematic effect. There was once upon a time that thematic effect was developed as a standalone product. It was not developed with the device in mind. Yeah.
But it's great with the device, right? To
Yeah,
use.
yeah, you can use it. Yeah. I think in general, when you use the device, because the dramatic effects is really still somewhat focused, I think, on the face, wasn't it? Yeah, it was not meant for the whole body. So, but it can be used. Yeah. I mean, there's no reason why it cannot be used together.
Okay, someone asked, and I know the answer to this one, but I'll let you answer it because you told me the other day. Why does the gel, after doing the demo, when, as you were mentioning, when it sloughs off the top layer of skin, why does it float in water?
Oh, okay. Somebody asked that question, Diana.
Yeah.
Really? Specifically afloat? Okay.
Yep.
Yeah, I've been wondering about it, right? And here's, again, this is, I have to do the experiment, but I think I'm right, even without the
Because
experimentation.
the gel by itself will sink. So once it's, okay, so go ahead.
Yeah. The reason is because as you use the gels on the skin, right, you're collecting this dead skin cells too, correct? So that's the color change. That accounts for that. Now, what I've been thinking is, why does it float when you take that whole glob or whatever you call it and you drop it on some water and it floats? It's because the skin is also secreting sebum, which is oil. All right. So as you scrape it, you're also, in addition to the skin cells, you're also collecting the oil, the sebum. So that whole glob that you have when you drop it in water is actually an oily precipitate in a way. All right. So when, not precipitate, but it's an oily thing. And oil floats on top of water. That's why it floats.
So it shows that you're purifying, that you're really removing.
purifying. Yeah.
Yep.
Yeah.
That's a great demo.
Yeah.
Okay, a couple other questions. Can we do the same? Can we use the 3 different routines in the same day, one after another?
If you have the time, sure.
I was like, as long as you're making phone calls and
yeah, go for it. Yeah. No problem.
And this one, can I in case of teeth implants, can I use it?
It's away from the face. It's likely I don't think it will have an impact. I think what that person might be referring to is that the microcurrent sometimes will also make them, they'll come in contact with the metal and it will make his or her teeth a little bit tingly. Yeah. But if you use it away from the face area, I suspect it's okay.
And then, or she clarified, so on the lower leg with enough gel, she says it hurts almost like when you're doing a deep fascia massage.
Yeah, but she feels better after that, right?
Yeah. So the pain isn't something you'd necessarily worry about. It's probably just part of it.
Yeah, but I mean, it's almost like self-adjusting. If it's painful, don't press too hard.
Hurts when I do this, doctor. Don't do that.
Right. Right. Yeah.
Well, I was just alerted by our very dear friend, Scott Van Pelt, that you have a meeting to go to. So Joe, thank you so much for your time. We just love and appreciate you so much. And I thank you all for the great questions. Sorry, we may not have gotten to all of them, but we'll be getting lots and lots of training. So, and the recording will be on the OTG Live Facebook page, as well as on the OTG Vimeo. And I know Hungary has it separate. So Joe, thank you again. Really, thanks for the innovation and thanks for the time.
All right.
Take care.
Bye.
Bye-bye.